Hi. So, few days back, we received a patient, a female 33-year-old patient, who was complaining of vague pain in the upper jaw and sometimes a pain on the joint side near in front of the ear since last few months on and off, but this was continuous since last nearly 10 days. She had been to many dentists. One of them even filled a cavity in the upper tooth, and even she went to the ENT thing, but she was getting no relief. Medicines sometimes gave her temporary relief, but the pain was constant, even though there was a sound that she could hear while moving her jaw. So when I examined her, of course, there was a very obvious clicking while opening and closing. Plus, there was a specific tenderness towards the tuberosity. By intraoral examination, I saw there was just the teeth were all healthy, present till second molar on both the sides, in one in maxilla. But there was a tenderness at the maxillary tuberosity on this right side, right? So we did one IOPA. This suspected something, and then we asked her to get one OPG done. Then the OPG showed us this. Of course, this tooth was hampering her jaw movement, and this tooth has to come out. So, but you can see that this was a tricky case, totally impacted maxillary third molar near the sinus, and the axial and sagittal positions we also needed to know. So we asked her to get one CBCT scan. This was the CBCT scan, and we decided to do the extraction under local anesthesia for the extraction of the impacted third molar. But the catch here was that the distobuccal root was also resorbed because of the pressure of the impacted third molar. So there was a plan of extracting that as well if needed, seeing how it is clinically when we enter the surgical space. So I'm glad that we could save that second molar. We took an endodontist opinion who was on team with us, and we just extracted the third molar intraorally only, and then just let the second molar be. After 7 days, when we removed the sutures, patient was totally pain free, no joint pain, no clicking, no vague pain on the upper jaw, nothing. So this is very satisfactory, and this case shows that it is very, very important to actually use your expertise and see beyond what you see clinically. And of course, we should give a benefit of doubt to what the patient is saying, what the symptoms patient is telling, and what he or she is complaining of. That is where our expertise lies, right? So, and by diagnosing the right thing, we will get on the track to treat it properly, whether it will be by the medicines or surgery or whatever measures, right? So we did the surgery and the patient was very satisfied. I'll post after this the videos of the surgery that was done, and of course the satisfied patient. I'm sure that this will help you in diagnosing such complicated, I would say, cases in which the complaint is correct, but the clinical signs are not. So we will have to search for that. Yes. Yeah. See that. So this is the totally impacted tooth in the oral cavity. We exposed this tooth, then we extracted. This is the empty socket. We were able to save the second molar, though the distobuccal root was resorbed. This is after suturing, and this is after the...
Yeah. Now the only thing is कि जो थोड़ा बहुत आपको रह गया है, that is also better today. From last night it is better, and but that jaw pain, that cheekbone pain, and that eye pain, that is all. I'm not feeling that pain right now.